Hi, my name is Joey Gray, and I'm going to be doing a video analysis of the film What's Eating Gilbert Grape, made in 1993. This is for my coursework in MFT6102, week 5 assignment. I'm going to start by describing the client, who is Mrs. Grape. She is a widow and she has 5 children. My diagnosis of her is that she has depression as well as some post-traumatic stress. The patient is extremely overweight, so in observing her, she finds calm, or she finds a sense of relief and sense of satisfaction and pleasure in eating, more specifically overeating. So this is definitely linked to her depression. According to the depressive orders page on the American Psychiatric Association's website, individuals who have trouble or who have trouble maintaining their diet, or who seek satisfaction and content in eating, those behaviors tend to be linked to depression. Also, she has a loss of care for her responsibilities and self-care. More specifically, she is unable to, because of her weight, but also because she's lost motivation, she's unable to take her children to school or other events that they want to go to, and so her older children who are able to drive are left up with that responsibility. As far as her self-care goes, again, because of her weight, but also because of her lack of motivation, she's not able to shower or change her clothes or cook a meal for herself or clean her house. So as a result, just like taking her younger children, driving them around and transporting them, her older son and daughter have to work to keep the house clean and keep their mother clean and keep the younger siblings clean and fed and, taken care of. Another reason why I believe that she has depression is that she does the same things day in and day out. So she, and a lot of this is because of her weight again, but she sleeps and she eats and she does her conversations and watches TV all in the same place, so in the living room. She barely gets up to move, if not just to use the restroom, and she, in my observing of her, she only got up one time in particular to go help with her youngest child to retrieve him from the authorities in an accident that happened. So because of those reasons, I believe Miss Grape to have depression disorder. The post-traumatic stress, I'm relating her behaviors to a little bit of post-traumatic stress because her husband, the father of her children, committed suicide. And because of this action, at one point, Miss Grape's daughter explained that before the incident, before their father committed suicide, their mother was much more well-kept. She was much more responsible, prettier, took care of herself, happier, that type of thing. So because of that comment and because of the extreme measures of what happened with their father, I believe that some of what Miss Grape is experiencing could be related to post-traumatic stress. Some diagnoses that I want to rule out are obsessive compulsive disorder and anxiety. So I do not believe that Miss Grape has obsessive compulsive disorder because I never observed her having any repeating habits, or I didn't see her obsessing over anything else in her life. She's a little obsessive about food, but I didn't really see her talking about it too much as she was just eating. And that is an obsessive action, but I don't think it's related to a compulsion disorder. I think it's related to her depression because she finds comfort in it. So she could have some symptoms of OCD, but I don't think those are her direct diagnoses. Also, I want to rule out anxiety just because she does have some mood swings, but I don't think that they're abnormal, and she doesn't show any frenzied behaviors or high blood pressure, or she doesn't say that she has any of those symptoms related to anxiety. The next thing I would like to talk about is potential treatments for Ms. Grape. I would like to talk about the effectiveness of these treatments and the potential drawbacks. The first treatment I'm going to be speaking about is psychopharmacological treatments. These include medications, and because before I started observing Ms. Grape, I saw that she was on medications. I assumed they were related to her depression, maybe. Perhaps they were diet pills. I'm not sure. I need to look into that more. But because she was already on medications, I assumed that maybe these could help. So the effectiveness of these psychopharmacological treatments is that she's already had experience with them. So her body already is adapted to them, which is good. Also, if we were to put her on antidepressants, they could help her become more motivated. They could help her to start thinking about her self-care, thinking about her responsibilities, her former self, those types of ideas. The drawbacks to psychopharmacological treatments is that they could interact with her other medications that she's on right now. So that's why I would have to look more into what the labels were on those pill bottles that I saw and what types of interactions that could happen if they aren't antidepressants and we would like to put her on antidepressants. Another drawback to using medication is that it could potentially numb her, or it could make it seem like she doesn't have to deal with her issues, like it could be an easy way out type of idea. So I would want to encourage her that if she is going to take antidepressants, or if she's currently on antidepressants, there are other types of treatments that need to be used in collaboration with antidepressants so that she's not ignoring the issue. The other type of treatment I would like to talk about is psychological treatment. And specifically, I would like to discuss CBT, cognitive behavioral therapy. In cognitive behavioral therapy, or CBT, this type of therapy would be like meeting one-on-one with the therapist to discuss issues and what's going on and that type of thing. This could help Ms. Grape because it could help her deal with her PTSD symptoms and her depression. A cognitive behavioral therapist could also help her grieve properly for her husband. So if this is something that's really getting in the way of her making progress with herself, with her unhappiness, with her eating disorder, with her post-traumatic stress, if grieving is an issue, then the therapist could help her become more aware of more healthy options for grieving, or also directing her to a grieving community group, something that she could do outside of therapy as well. The only drawback to cognitive behavioral therapy is that it could fail to meet the subjective issues pertaining to the whole family. So the good things that it could do is it could address Miss Grape's issues directly. And because she is the head of such a big household and all of her family members live with her, this could be good because it could address the issues that she's experiencing and how those affect her family. However, it wouldn't, cognitive behavioral therapy wouldn't necessarily be including those members of her family, right? So if there is an issue with the oldest sibling or with the youngest sibling, those wouldn't directly be addressed. It would just be Miss Grape's issues that are being addressed. So that would be the only drawback, is that the subjective issues were not being met directly. The other type of therapy I would like to discuss is family therapy-based treatments. Specifically, I would like to discuss marriage and family therapy. This would happen between the mother and her 5 children. In this case, a marriage and family therapist would work to take the family's beliefs and ideals and practice using them in a different way. So, for example, if the family believed that it was respectful not to talk about their mother's weight, which I did observe, and perhaps they could be guided towards understanding that they can show respect for their mother while also showing concern for her health and the growth of the family relations. So that's something that the marriage and family therapist would work with directly. In the readings that we've been discussing in our class discussions, we understand that these types of issues are called crisis inductions. So this is when the family is avoiding the issue of the father committing suicide and passing away. Another way the family is demonstrating crisis induction is by avoiding the issues of their mother's obesity. In Ms. Grape's case, her children accept their roles as the heads of household instead of challenging her life choices and bringing up the issues of their father's death and their mother's health to the service of their interactions. So everybody's just kind of ignoring what's going on and not really talking about it, which isn't the healthiest thing, which is something that the marriage and family therapist could address. Some specific questions that a marriage and family therapist would ask is, what types of feelings does Ms. Grape have about her condition, why her husband committed suicide, how she can not take care of her own family, what kind of feelings do those bring up? Also, how does the oldest sister feel about her brother getting into a relationship while she stays at home? So he's kind of getting some more free time, or maybe some more time outside of the household while she's left doing the chores. So we'd like to address that dynamic. As well as, I just think these types of questions can help a marriage and family therapist see the different perspectives held by the various family members rather than just one, in this case, Mrs. Grape. The drawbacks to marriage and family therapy, like I said with the collaborative behavioral therapy, is that marriage and family therapy discusses the subjective issues, including the whole family and non-therapy. So the drawback to that would be that it fails to focus on the mother as the head of the household and her responsibilities to grieve in a healthy way, since things start to get worse as a result of her grieving process. So we're not directly meeting with Mrs. Grape and talking about her grievances and her depression and her other types of behaviors. We're meeting with the whole family. So there might be a little bit, not necessarily regression, but there might not be as quick of progress from Mrs. Grape that we would like to see. The last type of treatment I would like to discuss is biomedical treatments. So according to the Boundless source, it's Boundless Psychology, Introduction to Biomedical Therapies. It's an article I researched online. Biomedical therapies approach psychological disorders as having, biological causes and focus on eliminating or alleviating symptoms of psychological disorders. Specifically, biological therapies believe that the mind and body are viewed as connected, that poor physical health leads to poor mental health and vice versa. So in knowing this could include, for Mrs. Grape, this could include working with a physical therapist to lower her weight. A physical therapist would get her up and moving, maybe do some training practices in a gym, or something to I mean, maybe even a dietitian could work with collaboratively with the physical therapist, just to help her develop a better sense of self-care, heighten her moods with the working out, releasing those endorphins, but mostly just helping her to lose weight so that she can get about the house, so that she can drive her car, take care of her children, that type of thing. The drawback to these biomedical treatment ideas is that they cannot, if Miss Grape decides to do biomedical treatments, then we will not be, then it would not be advised to use it alone, right? So it wouldn't be the best decision to use just biomedical treatments solely because it doesn't address the emotional symptoms. So she would still be, it would be great if she did biomedical treatments paired with marriage and family therapy, or paired with cognitive behavioral therapy, or paired with a medication. But it's not advised to do just biomedical treatment, since that addresses more of the physical part of the mind-body treatment, and not so much the mind or the emotional aspects, or what types of mental incapacity she might be experiencing because of the post-traumatic stress or because of the depression. And now that I've discussed these 4 different types of treatments, the biomedical treatment, marriage and family therapy, collaborative behavioral therapy, and the use of antidepressants and medication, I want to make sure that I address that after I come up with a treatment plan or an analysis of Mrs. Grape. I would definitely want to collaborate with my colleagues, not only on her diagnosis, but also on the potential treatments, because these, I want to make sure that I'm getting all the different kinds of perspectives that I need to get in order to give her the best treatment to meet all of her needs. And finally, I would like to say that the connections that were made between the class resources and the film, including Mrs. Grape, demonstrate different family dynamics and the marriage and family therapy principles that can assist the family in achieving positive family growth and individual excellence. By the end of this treatment, potentially, we want to be able to see how some of the role shifts have affected the family, or how they've taken place within the family, and we want to see how some of the issues brought about in the treatment and the therapy contribute to the overall goal of independence and family growth. So with that, I will conclude my video analysis. My name is Joey Gray, and this is an analysis of What's Eating Gilbert Grape, the 1993 film, for my MFT6102 course week 5 assignment. Thank you.